How does mosaicism affect prenatal genetic test results? Have you ever wondered how mosaicism can impact the results of prenatal genetic tests? It's a fascinating topic that many expectant parents might not be aware of. Mosaicism occurs when there are two or more genetically different cell lines within the same individual, all stemming from a single fertilized egg. This can create some unique challenges when it comes to interpreting prenatal genetic test results. Prenatal genetic tests are commonly used to screen for various genetic conditions. These tests include chorionic villus sampling, amniocentesis, and non-invasive prenatal testing. Each of these tests samples different types of tissues, which can lead to varying results when mosaicism is present. For instance, chorionic villus sampling collects placental tissue, which might detect mosaicism that is confined only to the placenta. This means that the test could show a positive result without indicating any issues in the fetus itself. On the other hand, amniocentesis samples cells from the amniotic fluid, which generally provides a clearer picture of the fetal genome. However, if the abnormal cells are not evenly spread out, there's still a chance that mosaicism could be missed. This can lead to uncertain or conflicting results that may confuse parents and healthcare providers alike. Mosaicism can result in false positive or false negative findings. For example, if mosaicism is present in the placenta but not in the fetus, a test result may indicate a potential issue that does not actually exist in the baby. Conversely, if mosaicism is only in the fetal tissues, it might not be detected at all if only placental cells are tested. The clinical outcomes of mosaicism can vary widely. The effects depend on which chromosomes or genes are involved, how many abnormal cells are present, and where they are located in the fetal tissues. Some mosaic conditions may lead to developmental challenges or structural anomalies, while others might have little to no impact on health. Genetic counseling becomes essential in these situations. Because mosaicism introduces uncertainty about the true genetic status of the fetus, it is important for families to understand the type of mosaicism and the tissues that were tested. Follow-up testing, such as amniocentesis after chorionic villus sampling or detailed ultrasound examinations, may be recommended to clarify any risks. Mosaicism can also influence pregnancy management decisions. If mosaicism is detected during prenatal screening, parents may need to consider additional testing, monitoring, or even their options regarding pregnancy continuation. However, it's worth noting that many cases of mosaicism, especially those confined to the placenta or with low levels, can result in healthy births. For families considering prenatal screening, it is important to remember that a positive mosaic result does not always mean that the baby will be affected. Additional diagnostic procedures may be necessary to understand the significance of the findings. Genetic counseling is crucial to explain the limitations of tests and the possible outcomes. Prenatal ultrasounds and follow-up assessments may also be needed to monitor fetal health. In summary, mosaicism adds a layer of complexity to prenatal genetic testing. It can create discrepancies between test results and actual fetal health. Careful interpretation by genetic specialists and personalized counseling can help families navigate these uncertainties effectively.